Okay, so we're going to talk about ergonomics for the sonographer. Repetitive motion injury is very common in sonography because that sonographer is continually using the upper extremity in different motions and different positions. So it is very important to understand ergonomics to keep the sonographer safe and healthy. So work-related musculoskeletal disorders and musculoskeletal disorders are injuries that are caused by aggravated by the workplace activities. So as we just talked about, you're using that same extremity over and over and over again. And if anybody's familiar with how an ultrasound department runs, if it's a busy department, it's patient after patient after patient. Some of the exams are not as strenuous, but others can be very strenuous and very lengthy. So these injuries account for up to 60% of the workplace illnesses, and more than 90% of sonographers have some form of MSD. So we're going to go over causes and risk factors. That's going to include biomechanical factors, which is how the extremity is moved, faulty work organization, and injury management. So the symptoms can present with pain, inflammation, swelling. There can be numbness, loss of sensation, a tingling, a burning, clumsiness, and muscle spasms. And the types of musculoskeletal disorders include tenosynovitis, tendonitis, carpal tunnel syndrome, cubital tunnel syndrome, thoracic outlet syndrome, and trigger finger. The types of musculoskeletal disorders is de Quervain disease, lateral medial epicondylitis, rotator cuff injury, bursitis of the shoulder, spinal degeneration, and neck and back strains. So we're going to touch on each of these. Most of them we're very familiar with. There may be a few new things that we talk about. So the inflammation of the muscle and the tendons occurs due to the frequency of the use and the duration of the use. So as we know in ultrasound, some exams can be done quickly in about 15 minutes. There's other exams such as a lengthy OB exam for multiple fetuses, or vascular studies for vein mapping and looking for DVT can be very long exams. The degeneration and micro tears and scar formation will follow with this type of frequency and duration in the use of the upper extremity or in the way that the patient or the technologist is sitting. The cures include pacing the work, so slowing down the workflow. Also, it's important for the schedulers to understand that you don't want to pack long, complex exams one after another. So in a prior facility that I worked at, if there was a lengthy study like looking for venous insufficiency, for example, where you're checking the lower extremity all the way up and down the leg and getting the patient into some unusual positions and therefore putting the tech in unusual positions, we made a rule that there would not be more than one of these per site or per tech per day. If our volumes increased, then we would readdress that. But our volumes were such where we could make it to where there was one a day. The other cures include appropriate amount of recovery time for an injury, and then reducing the muscular effort. And this can be done by making sure that proper ergonomics plays into how the exam is being done and set up. So the impact of MSK disorders could be minor discomfort to career-ending injuries. And that's really sad. I've worked with some sonographers where they could not do their livelihood any longer because of serious injury that they had. It can cause emotional and financial implications, and the impact on the employers and the co-workers and workers' compensation is very concerning, and it touches a lot of people in the department. The treatments will range from over-the-counter analgesics and anti-inflammatories to having surgery done. The treatment of work-related MSDs has a poor outcome, and that's mainly because what the patient's being treated for, they're going right back to doing what caused it. So it's like a pitcher who has to go have surgery done or be taken out of the game or put on the bench to rest that injury. When they go back and they're doing that exact same thing again, they're usually going to experience a repeat of that injury. The other thing is we can prevent injuries by addressing the risk factors. Injury prevention, there's individual prevention methods. There can be changes made in the department, and we talked a little bit about that, where we talked about how we schedule the exams, ergonomic principles, just using proper principles of what's the best way to set yourself up, how do you want the table set up as it relates to the chair, and how's the equipment set up. So there's ergonomic equipment measures that we need to think about, and the equipment manufacturers have become very in tune to the need to have really ergonomic pieces of equipment where the monitor can be moved independent of the control station, and the control station or control panel is independent of the monitor, so these can be moved, tilted, lowered, raised, and so forth. Ergonomic adaptations of current equipment. So we may, not everybody can go out and buy brand new equipment, but what can we do to adapt better to our current equipment? So we may not be in the state of being able to change the ultrasound unit, but perhaps we could better serve the technologists by getting a new patient table that raises and lowers, maybe getting a better chair for the technologist, and so forth. And then changes in scanning and workplace practices. And that could be to bringing somebody in to show proper ergonomics for ultrasound scanning, and then just workplace practices of, do we have appropriate time for there to be breaks for the employee to rest and exercise, and so forth. So here's a few examples of what not to do for injury prevention. So picture of one of the technologists who's standing and leaning over that patient to scan the lateral side of the patient is not a good practice. And then there's another one where you see a technologist in the chair and they're sitting up straight, leaning over to scan that patient. There are supports that we can use for the scanning arm to keep that arm more in line with the patient's body and keeping it more perpendicular to the surface that we're dealing with. You can have the patient self-augment venous flow when performing lower extremity exams by dorsiflexing the foot instead of the technologist making that happen. Reverse the patient's position to scan the left leg when performing bilateral lower extremity exams, and you're not leaning over the patient and putting yourself in a bad position. Then there's self-care that the technologist can do to practice strengthening exercises, stretch before starting to scan each day, and then talked a little bit about taking mini breaks during the patient exams, making sure that your eyes are examined so that you're not straining forward to see the screen or moving back to see the screen. And then when you do experience an acute injury, limit time at home spent on activities that use the upper extremities. So if our livelihood is ultrasound scanning, we have an injury, then we should make sure that we're not doing something at home that is kind of simulating that same type of use. So one of the things that I wanted to bring up that I didn't mention earlier in the PowerPoint was the de Quervain's syndrome. What that is a painful condition that affects the tendons on the thumb side of the wrist. And it is a common injury that happens. Usually what happens is when the technologist turns their wrist or grabs anything to make a fist, there's going to be a lot of pain. So it is a form of tenosynovitis, and it's usually something that happens because of repetitive hand or wrist movements. So therefore, ultrasound sees this quite a bit. I just wanted to bring that up because all the other conditions were self-explanatory, but this one was something that I wanted to make sure that we all knew about. So it does affect the thumb side of your wrist. So that will do it. Please review the other materials that have been handed to you along with this PowerPoint. It is what we will reference for the quiz.